Hello and welcome to the next instalment of our A to Z videos on general podiatric conditions and complaints, and remember to check out NK Sports Podiatry for their A to Z videos on podiatric MSK problems. Now today is the turn of W, and I want to talk about walking today, and there are a couple of reasons for this. Number one, walking is one of the best exercises that you can do. It's free, you don't need any equipment, you can go out, you can get fresh air, and it really does help. And second of all, the area I'm in has lots and lots of walkers. Now, whether they're ramblers, they do walking for health, we have the South Downs and beautiful countryside around here, they just go out on general walks, or I get a lot of dog walkers. And they get foot problems, and they don't need to. Why are they getting foot problems? Well, if anyone is a walker and they come in to see me, the number one thing I do is ask them about their footwear. Now, footwear is extremely important when you're walking, especially any distances. You have to make sure you're wearing the correct shoe. Now, you need the right shoe for the right job. There is no use going and doing a 10-mile walk in wellies or flip-flops. You really need a good substantial walking shoe or walking boot. Now in the summer, a decent pair of well-laced trainers can do the job as well, but you really need to be wearing the appropriate footwear for what you're doing. And it needs to be the right size. I call this the Goldilocks Syndrome. It can't be too big and it can't be too small. If it's too small, you will get problems like corns and calluses and blisters. And if it's too big, you will also get corns, calluses and blisters from excessive movement within the shoe. And whenever you're wearing good shoes, you need to make sure you have room for good socks. Socks are very important, especially if you're walking distances. You can get some excellent walking socks out there, and I've spoken about bamboo socks as well. You want something that's going to wick that moisture away because your feet are going to sweat. So socks and shoes are the number one thing to consider whenever you are getting foot problems when you're walking. Now the other thing is muscle strength. We can get muscle imbalances, we can get some muscle groups that tighten up and work harder than others, and it can lead to problems. You can have problems with your gait, you can have weak muscles, and if you have weak glutes, which is your bum muscle, you can get a change in gait. And a lot of people will say they get foot fatigue when they're walking long distance, and that can be the small intrinsic muscles in the foot. And if you see a podiatrist, they can help you with this. We can give you exercises to help you strengthen those muscle groups and hopefully stop you getting any problems. And balance is another problem when people go walking, and that can be down to muscle problems as well as other things. It's not necessarily related to the feet. And a lot of people think orthoses or insoles for the shoe are a bit of a cure-all if you have foot problems, and that is not the case. Sometimes they can be really, really useful, and we do give them out to a lot of people. They can be a temporary measure to go along with other exercises, or they can be more of a long-term option. But it's not a cure-all, they're not suitable for everyone. So do remember, if you're getting any problems with corns, calluses, blisters, foot pain, heel pain, ingrowing toenails, black toenails or athlete's foot, these are all problems you can get from walking, and these are all problems your podiatrist can help you with. Any comments, questions or queries, feel free to pop them in the comments or message me directly, and I will speak to you soon.